Good morning, good afternoon, good evening to you all, depending on where you are joining us from today. Firstly, I hope that you are all well and adjusting to working and living in this COVID-19 world. Welcome to this FIP webinar, part of the FIP online series, Increasing Vaccination Coverage Through Pharmacists. This is episode 4, Give It a Shot, Advocating for Pharmacy-Based Vaccination and Achieving Legislative Changes. My name is Paul Sinclair, and I'm the Chair of the Board of Pharmaceutical Practice at FIP and an immediate past President of the Community Pharmacy section. I'm a practicing community pharmacist from Sydney, Australia, and it is my pleasure to be the moderator of today's presentation. Firstly, I'll just ask Gonzo to just change that screen if you mind. And that'll be coming up shortly. But while he's doing that, a couple of housekeeping measures for today's presentation. The webinar is being recorded and will be available at fip.org. We encourage you all to become members of FIP, and you can do that at the website. All participants today are welcome to become members, individual members of FIP, and receive the full suite of benefits that membership delivers. We would ask today that you would ask questions via the Q&A box or the chat box at the bottom of your screen. We welcome feedback. Any feedback can be emailed to Mila, M-I-L-A, at fip.org. I think the screens are just coming up now. Just bear with me, thank you. That's the right screen. FIP would like to thank Sanofi Pasteur for funding this online event through an unrestricted educational grant. The program for today's webinar, we have a short introduction, then we have 3 very highly qualified speakers, all of whom I'm sure you will enjoy their presentations, a Q&A, and then a panel discussion. The learning objectives from today's webinar. After this webinar, participants should better understand the opportunity for appropriately trained pharmacists to deliver vaccination services, how to advocate for expanded scope of practice for pharmacists, and how to navigate regulatory and legislative requirements for pharmacist-delivered vaccination services. So why pharmacist-delivered vaccination? Preventable diseases such as influenza continue to kill too many people each year. To improve vaccine access and uptake, health systems must fully leverage the potential of pharmacists in their vaccination strategy. Pharmacists, as we know, are the most accessible primary healthcare professionals who have much to offer, not only as medicine experts, but also in delivery of professional services from the community pharmacy setting. FIP has recently released an overview of pharmacy's impact on immunisation coverage, a global survey of member organisations. This is an update on a baseline study that was done in 2016. And the update was released on the 4th of August last month. Key findings from this survey, which included responses from 106 member organisations from 99 countries and territories, included the following. 70% of respondents confirmed that pharmacists play an active role in educating the public on vaccine-preventable diseases, as well as advocating for vaccination. Pharmacy-based vaccination is now available in at least 36 countries and territories. Vaccine administration by pharmacists is authorised in 26 countries and territories, with 16 further countries proposing or developing pharmacist-led vaccination. Nearly 1.8 billion people around the world can access vaccination services at a community pharmacy. In most instances, pharmacist-delivered vaccination is paid for by the patient. Pharmacists are involved delivering 36 different types of vaccines, the most popular being influenza, 94%, hepatitis B, 61%, and tetanus, 58%. Most respondents to the survey, 96%, indicated that they can vaccinate adults. In 35 countries and territories where pharmacy-based vaccination is authorised, 100% of respondents indicated that postgraduate training for pharmacists in vaccination exists, while in 16 countries, undergraduate training also takes place. Pharmacists in their practice do not have access to vaccination records in most countries and territories. However, where there is pharmacy-based vaccination, 12 of 33 respondents said they had full access to vaccination records. With the world in the grasp of a COVID-19 pandemic and the development of a vaccine proceeding in many countries, the role of the pharmacist vaccinator will become even more important as the need for population-wide administration of a coronavirus vaccine eventuates. FIP has a strong history of support of pharmacist-delivered vaccination. This is well catalogued in the reports produced by FIP over the past decade, including vaccination advocacy toolkits for use by member organisations to the most recent survey, an overview of pharmacy impact on immunisation coverage, a global survey. FIP has also advocated at various WHO governance meetings, as well as regional and national pharmacy conferences across the globe. There are many barriers to pharmacy-based and pharmacist-delivered vaccination, not the least of which is opposition from regulators and legislators. As has successfully been shown in many countries, including Australia, this expansion of scope of practice of the pharmacist delivers enormous value to the wider population as well as the health system. Advocating for this expansion of scope of practice is the first step in achieving the required legislative changes. Today's panelists will each address this challenge from their own perspective, based on their experiences over the past 10 years. To introduce the first of our speakers for this webinar, firstly, Professor Lisa Nissen. Lisa is head of the School of Clinical Sciences at the Queensland University of Technology in Australia. Lisa is an experienced pharmacy practitioner, having worked in both hospital and community pharmacy settings. She's a strong believer in the benefits that multidisciplinary healthcare teams can bring to patient care. Her focus is on improving the quality use of medicines in the wider community across the healthcare continuum, with a focus on health service development and factors that influence the prescribing of medicines. Lisa was a leader of vaccination implementation in Australia through the Queensland Pharmacist Immunisation Pilot. Welcome, Lisa.
Thank you, Paul, and thank you, everybody. Great to see so many people from everywhere on the webinar tonight, and I hope that we'll have a great opportunity for some discussion later on in the Q&A after we've had the speakers. I really welcome the opportunity to talk a little bit about developing the competency of pharmacists and the pharmacy workforce for vaccine-related roles, and I really wanted to reflect on our development of the pharmacy vaccination workforce in Australia. And as Paul mentioned, that really evolved from what has been what feels like a long time, but only a very recent journey for us in vaccination in Australia from 2014-15. So only a few years ago, where some of the people that are on this call have been vaccinating for much longer, but hopefully some of our experiences will be valuable as countries consider some of the opportunities and some of the ways that we can move forward as a profession in the future. So next slide, please. So I think when we were looking at how we wanted to progress vaccination for pharmacy, I think what we came up against was not the unusual conversation, which was around scope of practice. And is vaccination something that pharmacy should be doing? Is it within our scope of practice? Is it something that we have the skills, the knowledge, the accountability, the authority to be doing? And so we really approached that in a number of different ways. And I think that what I wanted to sort of walk you through was the way that that kind of came together for us and a few of the things that we considered. So I think on the left-hand side of the slide here, there were a couple of things that really drove the pharmacist vaccination conversation, not only in my state, in Queensland, but more broadly was a conversation in Australia. So we'd seen what had happened in other countries in North America and in the UK particularly, and that had been happening up to a decade or a couple of decades already. And more recently in New Zealand, just over the ditch from us. But the government was very interested in access to vaccination, increasing the herd immunity, particularly for seasonal flu, and having had a number of seasons where we'd had high numbers of people that had died and admissions to acute care for flu. There was an interest in increasing the general population coverage, so the prevention agenda, and optimising the utilisation of the skill in the community that pharmacy could offer. So there was a belief by the government and the regulators, and some of those people being in the medical space, so our chief medical officers particularly, that pharmacists could contribute not only around our accessibility as people who could have contact in primary care in our community pharmacies with people, but an agenda around prevention and public health, but we could contribute skill as healthcare professionals. So if we took that package of support, how were we going to then sort of move that forward? I think it was really important for us to bring together the profession, so the Pharmacy Guild, so the organisation of owners of pharmacies in Australia for us, the Pharmaceutical Society, so professional organisation, together to work with our registering authority to look at how pharmacists could bring that scope of practice together with our accreditation body that looks at our training to produce somebody who was a pharmacy vaccinator in Australia. And then, you know, we needed to look at how we could do that and do that quite quickly, because we couldn't go back and, in this context of getting something happening quickly, retool all of our undergraduate courses and wait 4 years to get somebody out there. So next slide, please. So what we leveraged off was the fact that pharmacists already had skills in relevant competencies. And while we had a number of nurse vaccination programs available, and nurses in Australia have to undertake a certificate program to become vaccinators, those courses weren't really seen as relevant to us. And we were very lucky that we were able to use the National Immunisation Education Framework for health professionals, which is a national competency standard, as some leverage to say that really many of those competencies are already things that pharmacists have in their core competencies as health professionals because of our mastery in medicines management. So things around cold chain, things around immunity, disease, vaccinations, vaccine schedules, anaphylaxis, and the list went on and on. And so when we were having discussions with the regulators around what they felt were the gaps, what were the things that pharmacists didn't know, what were the things that they really felt a training program for pharmacist vaccinators might look like, they said, well, we don't see any point in you doing the nurse training. What we see is that pharmacists don't generally do a lot of touching of people, and they meant that in a nice way. They acknowledge that we do a lot of minor ailment work, we do a lot of wound management, we do a lot of first contact management in primary care, but we don't do necessarily management of declining patients. We don't necessarily give injections. We talk to people about it, but we don't necessarily give injections. So they felt that that was probably the piece that we needed. So can we have the next slide, please? So that really gave us the green light to go ahead and say, okay, well, if we have a look at some training programs for pharmacists from some other jurisdictions, and we had some good connections with some collaborators in Canada that were happy to share the training that they've been using, and I acknowledge our colleagues in Alberta who were happy to share the training they'd been using for 10 years. It really was a program that looked and focused on the physical delivery of vaccines and a refresher around what is a vaccine and vaccination. So we were able to uplift that program very quickly, adapt it to the Australian context around our vaccines and our practice around our immunisation schedule, look at the practitioner content using Australian pharmacists and some trained nurse educators and nurse vaccinators from Australia, and get that approved by Queensland Health, so our Chief Medical Officer, and to create that into a training workshop for pharmacists. So we were able to uplift that in a very quick period. So within a matter of a couple of months, we were able to get a training program available for pharmacists. So we were asked to have a vaccination program available for pharmacists in quite literally a 3-month period. And this was part of the way that we were able to do that. Next slide, please. So what we needed that was quite important, as many of you may not find surprising, some of our colleagues were not excited about the idea that pharmacists would suddenly be vaccinating. Obviously, our medical colleagues were not always supportive. Some of the medical organisations expressed that they were very concerned that pharmacists would not be able to manage declining patients, that we would not be able to manage somebody having anaphylaxis, that we didn't have the ability to manage giving injections. And obviously there were some nursing colleagues that felt that too. So we felt that we had to have very robust, relevant and defensible training. So we had some online background training that was a refresher around some of that theoretical knowledge. We had nationally approved training around anaphylaxis that other health professionals do, which gives a certificate that people needed to achieve. We had to have first aid and CPR currency. And then the in-class training, the hands-on workshop that people did, gave refresher on hygiene and infection control, patient assessment, injection technique, the use of anaphylaxis within the scope of managing different patient scenarios. So if you can pop on to the next slide for me. I think the part that was probably most interesting watching groups of pharmacists do this was watching them physically deal with the ampules, the syringes, and actually get into the task of administering simulated, but not simulated, real needles, but not obviously vaccines to each other. Some people had a shaky start, I think would be a generous way of putting it. Literally, the person that gave me the first one was a little shaky, but after having a few practice goes, people really found that opportunity to use the practice pads and then to move on giving injections to each other. And then having Damien's, the fellow over on the right, I think he must have had thousands of injections from pharmacists as part of the assessment. Doing that actual physical test and physical competency assessment before people were signed off to be able to give vaccinations was a great assurance for them that they'd been observed, and then actually going on to be able to do that in practice on real patients. Next slide, please. So over the course of the one before, so over the course of the 2 phases of the pilot, which was over 2 different flu seasons, the first implementation we trained 157, so nearly 160 pharmacists across 80 pharmacies in that first couple of months. Which was quite a mammoth task to do with face-to-face workshops. And in the second season, we trained a further 300 pharmacists So total participants was a significant number across those 2 seasons, and that was certainly in partnership with the professional organisations to do so. And in Australia, the Pharmacy Guild and the Pharmaceutical Society both deliver vaccination training for pharmacists going forward, and that's available now. I would put at this point a follow-on from that is that from a regulatory point of view, each of the states is slightly different on what can happen, but within Queensland, students are now able to be vaccinators under the supervision of a pharmacist that has that scope of practice. And so obviously the workforce going forward is now increasing quite rapidly as graduates come out of university able to vaccinate, so they hit the ground running. And other states have it that you can do that in your internship year. So no longer are we really retrofitting the profession, although the courses are still available for pharmacists who are registered to come back and upskill. Graduates are really hitting the ground running, coming out as people that are qualified to vaccinate, which really gives us the large volume workforce. And I think, as Paul suggested, with COVID vaccine starting to be something on the horizon, and pharmacists being very clearly, at least in Australia, and I imagine many other countries, on the pandemic planning lists as people that will be providers of those vaccines. Our jurisdictional health departments are very, very interested in having large volume workforces able to administer those vaccines in pharmacies, and have been asking us how many students are graduating this year. If you want to go to the next slide, just to prove that it wasn't a fluke, and as educators, it's always good to ask people what they thought of the training. So the first part of the slide is around learning outcomes and what people thought the relevance of it was. On a 0 to 5 scale, they really felt that, you know, it really matched what they thought they should be having around vaccination training, and overall they really rated the program highly, and what the workshop provided them with regard to sort of comfort around giving the vaccines and doing the training, but overall the confidence they felt they left with going off into practice to give vaccines. And just to finish off, I wanted to leave you with a couple of comments from people who participated. I think people were maybe a little anxious when they came into the workshop, but if you can just give me the last slide with the little jelly people. I think the first comment there, that they were nervous at first but surprised how little it hurt. That was good, that they wanted some more practice, and what we found is the more people gave vaccines when they got out in practice, the better they felt about it. They felt confident about having that opportunity to actually give physical injections during the training. And I think COVID's provided some challenges for us with regard to training. I think it's been quite challenging for uplifting vaccine training at this point in time. We've had about a 300% increase in flu vaccines this season, and a lot of people interested in doing training, but we obviously have had difficulties providing the usual workshops, and so had to be a little bit more creative about how we do the actual physical training component. But I think the message is that we need to fit the profession from both ends. And I think that pharmacists really had a lot to bring to the table with our baseline training in medicines, cold chain, managing patients, understanding patient flow. And I think going forward, as Paul said, we've already been able to jump off the back of flu. We've just added ACWY, pneumococcal vaccine, MMR, and the list goes on. So I think pharmacists as vaccinators has an ever-expanding role in practice, not only in Australia, but internationally. Thank you.
Thank you, Lisa. A very interesting presentation, and we'll have a little further discussion later about the importance of the collaboration between the various actors that you mentioned. Our next presentation will be advocacy best practices and France as a case study. Our presenter is Dr. Carrie Wolf-Fowl, who is president of the pharmacy of the French Chamber of Pharmacists. Carrie is a practicing community pharmacist from France and has been chair of the National Council of the French Chamber of Pharmacists since July 2017. She has been involved in the regulatory and professional activities of the Chamber since 2012. And she has also been involved in international affairs for a number of years, in particular representing the French Chamber to the Pharmaceutical Group of the European Union, an organisation representing over 400,000 community pharmacists in Europe. Welcome, Carrie.
Thank you very much, Paul. Hi, everybody. I hope you're all doing well. Thank you very much for inviting me, explaining you the French experience, which has been a very great, I must say. So I really hope that many of you will have the chance to experience this journey. I will start with explaining you the context. So I think I have to move the slide. Oops.
Ah, c'est bon, c'est bon.
Okay. Let me. I'm not sure I have the slide on. I don't see my presentation on. Yes, great. So a couple of words on the context, which basically was pretty favorable. First of all, in France, we have a very low vaccination coverage. The goal from a public health objectives is fixed at 75%, but in France, we have only 46% of vaccination among the population at risk, which is therefore very low compared to the objective. Secondly, the population was very much in favor of pharmacists to vaccinate, to simplify their journey for vaccine and access to vaccine. When 1 French out of 2 had never access to vaccination, and among these, most of them was explaining that if they were able to be vaccinated in pharmacies, they would go for vaccination. So a very strong support from the population. Basically, as I was saying, because this would simplify their access to vaccination for several reasons. First, because in France, but I think in many of our countries, we lack general practitioners. So having access for an appointment to general practitioners is not always easy, especially in the time of autumn where we should be vaccinated. And on the other hand, the pharmacists are very well spread among the French territory, and we have access to pharmacy basically very easily in France. The purpose was really to start with an experimentation. We never claimed to go straight for a vaccine for all pharmacists. We were convinced that the way to go was to suggest to start with a very small experimentation. Another favorable context was that there was a growing awareness of the authorities to do something to improve vaccination. There have been a publication of a parliamentary report which basically was saying that there was a really urgent need from authorities to take decision to improve access to vaccination. And at the same time, the government has organized a civic consultation of the whole population, which was conducted by a very famous professor in France in January 2016, which also show to the authorities that really it was time to do something about access to vaccination. Therefore, in that context, to give you an idea of the timeline process, in this context, in December 2016, the government has authorized by law a pilot for 3 years. The first year, the first season, it was only 2 regions in France which were allowed to conduct this pilot. And it was also planned that there would be 2 more regions the second year. And there would be a third year extended to all the territory. But actually what happened is, as it was a very frank success from the first year and the second year, the pilot stopped prematurely at the second year, so that the third year it was already all the French territory, which all the pharmacies from the whole territory, which has been authorized to vaccinate. A couple of words about, again, this timeline process. What has been a challenge for us is that, as you can see, by law, we have been authorized in December 2016, but the official text came out only in April, describing precisely the specification that needed to be in place. So between April and September, we had only basically 6 months to put everything in place so that pharmacists could be able to start vaccinate in those 2 regions as of September. So that has been one of the main challenges that we had to face. If I can, of course, as some of you have already expressed in your question in the chat, there had strong resistance from physicians and nurses who were afraid that we would take their patient and their activities, but also afraid that we would not be able to manage the vaccination in our facilities. So we had to build a very strong and complete authorization process to reassure everybody that there was no big problem for pharmacists to vaccinate, and this authorization process was pretty heavy. Of course, we had to put in place a training, and all pharmacists had to go through this training. All pharmacists had to prove that their premises facility were adapted to have patients being vaccinated in their facility, meaning that we had to have a confidential area to receive the patient and do the vaccination. We had to prove that we have a waste management process in place to eliminate the syringe and the tissues and so on. We had to prove how we manage the patient when he arrives in the pharmacies, like inform the patient, get the consent of the patient, keep the patient in our room for 10 minutes after the vaccination to make sure that there was no strong reaction to the vaccination, and also put a process in place to inform the GPs that we, as a pharmacist, have vaccinated their patient. So all this has to be proved by the pharmacist, and the pharmacist has to compile a file to submit to the regional competent authorities, who then would approve the pharmacist to vaccinate, and then the pharmacist would basically start to vaccine. So you can see that this was a very heavy process to put in place, but that was the only condition to reassure all parties that we could really do it in a secure way, both for the pharmacist, the patient, and the other health professionals around the patient. And all this had to be put in place in 6 months, basically, between, again, the time when the specification came out from the government in April and the first season in September. But the first advice I would give you is that make sure that you have really a package ready to give to the authorities, so that you have really think about all aspects, so that everybody feel reassured about the experimentation. So I think what has been also a key success factor is that we have involved all the professions from the beginning, meaning the unions, the students, the academy, and from the first day we really worked together to put in place this whole program together. So that's one. Second, we have a strong relation with policy makers. As I was saying at the beginning, the health minister at this time was pretty much in favor of this, but also we managed to have influential MPs on board, specialists on vaccination and immunology system. And as I just mentioned before, also the importance of providing the authorities a really turnkey scheme for this experimentation, so that basically the government has nothing else to do to secure the experimentation. Something very important is the communication and press campaign, and so that we could have the opinion in favor of this, and this has been very helpful, because in the population it was like an evidence that the pharmacists should vaccinate. Therefore, the GPs and the nurses was difficult to say no, because there was such a desire from the population that it was difficult to fight. From the part of the pharmacist, at the beginning, we were not quite sure whether the pharmacists would be really willing to do the vaccination, because some of them were skeptical or afraid of. So fortunately, the training program, as Lisa said, really give confidence to the pharmacists to go into this new challenge. But we had to do a lot of communication to pharmacists. What we did also within this package I was mentioning earlier, we as a chamber provided a platform, an online platform, which served different objectives. First, it allowed the pharmacists to go on this platform and have all information they needed based on the training also, obviously, but also when they started vaccination, to have all the forms they needed, like the consent form for the patient. They have all the information on this platform. And this platform helped also to gather data, because that was something the government asked us, is to provide data so that they could follow really on a real time how we were progressing in doing vaccination. So that's also something I would strongly advise, is to have a platform tool to help, and that would give access also to authorities. With all these conditions, there was not that much resistance from the pharmacists, And I think what has been also a success is that even pharmacists who were skeptical or afraid at the beginning, we had so many demand from the patients that the pharmacists had to accept at the end, because it was really a strong push in our pharmacies from the patient. So even a pharmacist who was a little bit afraid at the beginning, at the end of the day, well, he said, okay, I'm going to do it because I have so many demand. So I think, again, the population pressure was very important. Talking about numbers, we have been very happy to see that over the first 2 years of the pilot, we had 12,000, nearly 13,000 pharmacists which managed to have this authorization, meaning approximately nearly 7,000 community pharmacies, which represent 60% of the community pharmacists. So that's really important for this pilot phase to have that many pharmacists engaged. The tip and advice I can give today is again to involve and support pharmacists. As I was mentioning, to start with a pilot, I mean start really step by step a pilot and only flu vaccination. Don't go to start with many vaccination. Also because flu vaccination is no risk. There is no issue with pharmacovigilance or so on. It's a very safe vaccination. So that's really the way to go, is start with a pilot and only with a flu vaccination. Manage quickly to get through the authorization process so that there is no time for discussion and way back and forth. Go with a package and go for it quickly. The training and quality process is very important, again, to reassure all parties. Strong, you have to build a strong advocacy strategy among the authorities, and really you complement to vaccination by other healthcare professionals. That's very important. We always claim that we don't want to do vaccination instead of general practitioner or nurse. We want to do in complementary and in addition to other. The goal is really to increase this coverage of vaccination and not to move population from GPs or pharmacists. And by the way, one of the counterparts which had been decided by the government at the very beginning, back in 2016, is that, okay, the pharmacists would do vaccination, but the GPs would have also vaccine within their facilities to vaccine directly the patient when they would come to the GPs. Which, because as you may know, in France, the vaccines are dispensed only by pharmacists. There is no other way else where a vaccine is available. So that was a kind of deal. Pharmacists do vaccination, but the GPs have vaccines available to vaccine directly the patient. This part of the law has never really started because the experimentation for the GPs has never really started. And what we understand as up to now is that finally the GPs are not very keen in having vaccines by their side, because it's, as you know, some work to manage the cold chain and so on. So at the end, the GPs don't vaccinate now at the time we talk in their facility. So really that was an important thing to really convince that we don't want to vaccine instead, but in addition. Moving forward from success to success, as I was saying as an introduction, the pilot was very successful, and it led to many other changes after that, with a new range of mission as of July 2019, because it really changed the perception of what the pharmacist could do. Suddenly, he was not only the one giving boxes of treatment, but he was also able to have in a confidential room a kind of consultation with the patient. He was touching the patient, he was doing an act, and in completely safe manner, and it led to many change in the perception of the pharmacist as really a health professional. So we managed to get other services in the benefit of the patient that you can see on the screen. Something which is not on the screen, and I want to mention also, is as of this day, we have the authorization to do a rapid diagnostic test, like the one to detect engine, whether it's a viral or bacterial engine. And in this period of COVID, we had the authorization to do also rapid test for COVID detection. So again, this vaccination, beside the great benefits of increasing vaccination, it also leads to other missions given to pharmacists, since we managed to prove that definitely we were able to do this kind of practice. This is the main message I wanted to give to you. So thank you very much, and happy to answer your questions.
Thank you, Carrie. A wonderful presentation. And I think for any organisation or any group of pharmacists who are looking for a starting point and a roadmap to introduce a vaccination service, the French experience, I think, is a very good one. Thank you, Carrie. Our final presentation will be delivered by Mr. David Sinclair, the Director of the International Longevity Centre, UK. David will present on effective advocacy approaches for pharmacists' contribution to improving vaccination coverage. David has worked in policy and research on ageing and demographic change for the past 15 years. David has a particular interest in older consumers, active ageing, adult vaccination, and the role of technology in an ageing society. David has presented on longevity and demographic change across the world. David has also previously worked with a member of the British Parliament and with backbench committees. Welcome, David.
Thanks, Paul, and thank you, everyone. It's great to be here. I was just reflecting it. A year ago, I was in Abu Dhabi with many of you. It seems like such a long time ago now. I'm going to, I suppose, make 3 points during my presentation. Firstly, that I think it's really important that we better use pharmacists across the world in terms of vaccination. Secondly, that there really is some great work going on, and we've just heard about what's been happening in France and Australia. I think pharmacists are absolutely responding to the challenge. And then I think thirdly, there are some things which can be done to enhance the role of pharmacy, and I suppose I've got some tips on what I think the sector should be advocating for. In terms of my organisation and our expertise, our focus is very much on adult vaccinations, or vaccinations of older people. So I'm really talking from this perspective. The International Longevity Centre in the UK is one of 16 across the world, and we have sister organisations everywhere from the United States to the Dominican Republic, and from Australia, of course, to Singapore. So we with our colleagues, we work across the whole world. Of course, what this winter does, it shows, I think, presents a huge catalyst opportunity for pharmacy to really step up in many countries as a fear of a second wave of COVID emerges. And I think what COVID has done is really highlighted the stark reality of world government's complacency in terms of infectious diseases and prioritising prevention across the life course. Our research, ILC UK's research, has showed that in better off countries in 27 alone, about 27 million years will live with a disability due to largely preventable age-related diseases. So we know prevention works. Yet we also know that it doesn't get the profile it should. We know that if governments fail to prioritise preventative health interventions, that across the world, the years lived in poor health in some of the richest countries will increase by about 20% over the next 25 years. And we also know there's a major economic cost of failing to deliver adult vaccination prevention across the life course. A report we did last year showed that in better off countries alone, $39 billion a year is lost in terms of productivity every year as a result of influenza. And so we know there is some very good cost effectiveness evidence. And of course, what COVID has shown is the economic impact of infectious diseases is much, much higher than the pure health costs. So clearly, you know, the health costs are one aspect. You know, if people get disease and end up in hospital, is a significant cost to healthcare systems. But actually what COVID has shown is that the costs of the economic costs of failing to prevent or an infectious disease could be much more significant. So we know, you know, and I really believe pharmacists can play a really important role in providing some of this preventative healthcare, including vaccination. And I think as a result that the sector has a really important role in reducing the burden on healthcare systems. So let me jump back to my 3 points. So important that we better use pharmacists. Why? And some of these points have already made. Firstly, we have an aging world. We have more and more pressure on GP surgeries. GPs are expected to do so much more across the whole world. So general practitioners already expected to do so much and have potentially more people who need their services. At the same time, we have in some places fairly poor access to GPs. People don't have access to the primary care at the sort of level that they need. We did some work on Hong Kong and healthy aging last year, and one of the things that was really interesting in Hong Kong, I might come back to this, is that actually if you're outside the private healthcare system, there are very few general practitioner services, and yet there are pharmacies, but pharmacists are not really allowed to do anything. So you've got qualified healthcare professionals who potentially could play a big role, but just don't have the ability to do so. We also know that more of us are living with multiple health conditions, and I think another reason why it's important we use pharmacists better is that, of course, some people in risk groups or in at-risk groups are likely to receive medication for a pharmacy, but may well very rarely go to a general practitioner. Actually, most of their healthcare might be being delivered within a pharmacy. So clearly, it's for many people a really, really important place to receive healthcare services. I've already mentioned, I think skills shortages across the world is a major challenge. We simply, doctors might of course say that this is an important part of their role, but the reality is doctors are under a huge amount of pressure and we just don't have enough. And I think the final point why I think it's important we better use pharmacists is community settings can actually be better for some preventative treatments, actually going somewhere which is potentially closer to you, or going somewhere where you can, which is more accessible, has real potential, I think, to get vaccination out to more people. So I think without a doubt there's a role for pharmacists to play. Second point I want to make, there's clearly some great work going on around the world, and I heard about a lot of it in Abu Dhabi last week, and and we were very privileged to sort of present about some of our work and meet some of you at the events we did in Abu Dhabi last year. So there is, and I think I really learned about all of the brilliant work that is going on across the world. We know, for example, that there has been a 6-week pilot carried out in Portugal where community pharmacies offered free vaccinations, resulted in a 31%, so a third increase in uptake of vaccinations, with a particular success in reaching those over 65. We know in terms of France, and we've just heard about that, the pilot led to vaccination of 750,000 people, with a quarter of those receiving the vaccination for the first time. At FIP last year, we heard about places like Zambia, where pharmacists are playing a huge part in helping understaffed healthcare services provide access to information, advice, other preventative services. Similarly, in places like Brazil, the development of things like collaborative care models for patients with diabetes have been really important in terms of the pharmacist's role. So I suppose one say, across the world, we're starting to see change, and I think the survey that was talked about earlier on picked that up. In the UK, our health minister wants this year's influenza vaccine to be the biggest in history, and has argued that pharmacies will play a really important role in achieving this. So I think pharmacists, community pharmacists are stepping up to the challenge, but of course, as has already come up, there are some big challenges in terms of the regulatory environment, in terms of how we make the most of this really important resource, and that's where I suppose I'm going to focus my points for the next few minutes or so. So what could you do, and what should you do within your countries? I think the first thing to do, we have a really interesting initiative in the UK, which I think was led by our Royal College of Nursing, called Every Contact Matters. And the idea here was that if someone goes into a hospital with a broken hip, when they go into the hospital, the doctor or consultant says, by the way, have you had your pneumococcal vaccine yet? If you go in to see a nurse for a blood pressure test, the nurse says, by the way, have you had your flu vaccine? I think pharmacy, should within healthcare models be advocating to play a part in this every contact matters. So when someone comes into pharmacy for a prescription, identify, by the way, have you had your flu vaccine? By the way, have you had your, hopefully COVID vaccine eventually? So I think there is something there that I think that could be advocated for, and I think there is clearly a challenge that's been touched on, but I think it's really important that the pharmacy sector works out how you do share data with doctors and other healthcare professionals, because I don't think that shouldn't be a complicated problem, but it's often put up as a barrier to the a reason why pharmacists shouldn't be vaccinating, and I think we need to overcome that. Secondly, I think it's important to recognise that pharmacists shouldn't, we're not necessarily just talking about, and we heard about this from Australia, pharmacists delivering vaccination directly. Pharmacists have a huge responsibility and opportunity in terms of signposting to other services and providing, medical advice. I think clearly one of the challenges there is the reimbursement. So how do you make sure you're, that you are being adequately reimbursed for these services? But clearly, it is such an important role for you to be doing. I think that there is, and I've touched on the importance of data, but I think community pharmacy needs to both use and be able to access big data. And I think a big advocacy opportunity is around the potential for using data, maybe data you have, data within healthcare systems, to identify people who can most benefit from immunisation. I've talked a bit about the potential for vaccination in terms of the potential of pharmacy in terms of information and advice. And I do think that there is a really important role to be played in terms of creating an informed consumer. Many people who are entitled to a vaccination don't know they're entitled. They think they're healthy. They don't think that it's something for them. I don't know the situation across the world, but of course in the UK we always have we have in childhood this initiative called the Red Book, where basically when you're a child, you have this Red Book and you get a tick and a stamp when you've had your vaccination. When you come into adults, you don't really have that anymore. So actually, many of us don't know if we've had our tetanus or we're up to date with our diphtheria vaccination, simply because we just don't keep a record of it anymore. And I do think that the role of community pharmacy, where people are going in weekly, monthly, daily, to actually promote posters, have posters, to actually move the social norm in this space. And I think there's a big role for community pharmacy to help there. I think another area where you can really advocate is around your really important role in terms of reaching people who are difficult to reach. Pharmacists, as I touched on, are really close, and they are close to the communities they serve, and I think it's there is real significant potential to use this as an advocacy tool with governments that as I say, there are people who don't go into doctors who do go into a pharmacy, and I think that you should be playing on that within your advocacy work. I think another thing for you to think about, and again, I sort of touched on this a little, is highlighting really how accessible you are and how close to the population you are. And I mentioned the work in Hong Kong. We did in Hong Kong, I think when we did the work last year, there were 640 pharmacies and 2,700 pharmacists, and they were often close to where people lived. Yet actually even dispensing is a challenge in Hong Kong. So actually being able to go to the high street and have these services a really important advocacy tool. I think another thing that you can do in terms of your in terms of the pharmacy sector is clearly advocate around how you can make vaccination convenient for people. So, for example, the high street pharmacies in the UK have all started doing advertising for this year's winter flu vaccine, and you can book online. It's worth saying it's been extraordinarily popular, and I think I saw on social media this week that actually one of our pharmacists, one of our big chains, actually ended up this week having to have an online queue, like a huge music festival for people to book their flu vaccines, because it's so popular and there's so much demand. So actually being able to both just pop in and make your online, but make your offer convenient is extremely important. Now, I think the other thing you can do in terms of advocacy is really emphasize your cost effectiveness, that actually pharmacy is potentially a very cost effective way of delivering, whether it be flu, pneumococcal or other vaccinations. I think the other points that I think the sector could do in terms of promoting this space is actually supporting some of the more general campaigns, so campaigns that people like FIP that are working on in relation to adult vaccines or vaccines generally, because I think that there is a case for a bit more noise in this space. So, and the sort of things I think that the bigger picture things which I think the sector could be advocating for is, firstly, a right to, or an advocacy around ensuring that reimbursement is available. So, in the case of a COVID vaccine or a flu vaccine, actually we know that it probably needs to be free to the end user if we're going to get high uptake. So actually an advocacy movement around reimbursement, I think, is extremely important. Secondly, I think what we also know is that what encourages people to go to, whether it be to a pharmacy or to a doctor or anywhere else, for a vaccine, is that you have a very strong recommendation from your NITAG, from your National Immunisation Technical Advisory Group. So it's really, really important, I think, across the world that we are advocating for strong evidence-based recommendations across the life course. Thirdly, I think you have a role to advocate for your costs to be covered and the costs of other healthcare professionals. The personal organisation delivering the vaccination needs to have their costs adequately covered, or they simply won't be able to deliver vaccination in a way that is sustainable. I think you could play a really important role of advocating for consistent recommendations across regions within your country. It's clearly not helpful if, you know, in one region you have one guideline and in another region you have different guideline. It potentially undermines the confidence in supply of the confidence in vaccines, and I think there's a big role in actually sort of, you know, in you helping in that space. And now I think finally, I think the you know, the role of pharmacy, you know, pharmacy has an important advocacy role in terms of highlighting the need for investment in infrastructure. We know we need to recruit and train additional staff, both doctors, nurses, as well as community pharmacists. We know we might need, you know, in COVID, in relation to COVID, for example, there is talk in the UK that we may well be using both for COVID and, well, for flu this year, our polling stations. So the places where people go to vote we have a network of places like schools and community centres across the world, across the country, and we are starting to think about how we can use these to deliver flu and pneumococcal and other vaccinations over this winter, because the reality is that, you know, we will need to be able to vaccinate people in a socially distanced way, and actually it may be difficult in some places to deliver that. So I think there's something about the sector advocating for the right sort of infrastructure. We also know that some people in at-risk groups might not want to go to doctors, and we are seeing this in the UK because of a fear of leaving home. So actually, you know, a fear of COVID or of other infectious diseases. And we need to make sure that the infrastructure we're developing and the advocacy that you're doing is actually emphasising the you know, or minimising the risk of this, because clearly there are major risks if groups of our most vulnerable, either at risk or older people, don't get vaccinated because they're terrified to leave their home. So I'm going to finish there, just say, I think, you know, in terms of, if we really want society to work for everyone, regardless of their age, prevention across the life course must be a reality. We've got to inspire and engage the policymakers to strengthen the role that both healthcare professionals and allied professionals can play in promoting this. And I think finally, providing pharmacists with the means to both deliver vaccines and indeed to provide better information and advice, support, for individuals around vaccination can really help reduce the burden on healthcare systems across the world. And I do think that, you know, just to finish where I started, that, you know, there are clearly some great work going across the world. Pharmacists are responding to the challenge. So thank you very much for doing that.
Thank you, David. A very interesting presentation, and particularly from the point of view of the older consumer, because particularly in a COVID environment, the older cohort of the population is certainly more vulnerable. And that's where pharmacy may have a very significant opportunity in terms of delivery of a vaccine when and if it is made available. So thank you to our panelists. We now come to the Q&A part of the webinar. And thank you to all the people who have posted questions. And there are a couple of questions here along the same vein. So we'll deal with a couple of these if we may. And one of the big stumbling blocks in any advocacy process for increasing the scope of practice by way of pharmacists to deliver vaccinations tends to be other healthcare professionals. Mikhail Urban from Czechoslovakia has sent us a question. Was it only challenging towards legislators and regulators, or also towards other healthcare professionals, mainly physicians, to convince them that pharmacists could be competent professionals for vaccinations? There is big pushback from doctors in the Czech Republic. A similar question was sent from Jared McMore. But I think it's important to realise that there will always be noise from other professional bodies, because that's their job. It's the job of the medical associations to protect their turf. And certainly in Australia, the experience we had when we were busy in the advocacy role was that publicly the doctors didn't support it at all, but privately, many of the doctors were happy to see pharmacists vaccinate. So it's not as big a stumbling block as you perhaps think it might be. But I'd be interested to hear from our panelists, just with a quick response, if we may. Lisa, to you firstly.
Yeah, no, thank you, and I concur with your thoughts there, Paul. And I think there's a couple of pieces of reflection and feedback on that for people that are starting the journey. As Paul would know, having worked with the Pharmacy Guild, and I was working with the society at the time, having sort of the professional organisations work together from a pharmacy point of view, but also we had a steering group that engaged with our medical colleagues as well as the Department of Health, and kind of brought them on the journey, listened to their concerns, and I think knowing what they were going to bring forward as their considerations. So they were worried about the declining patient. They thought that we were going to vaccinate amongst the toilet paper and toothpaste. They were the things that they were worried about. So we went on the front foot first. So we made sure that we had the anaphylaxis training, that we had the CPR and the first aid, that we'd done training around the declining patient and patient assessment, that pharmacies had to have a private clinical space that they were doing it. So every time they came forward and said, you don't have this, we go, but we do. You don't have this, but we do. So I think by listening to what they were saying and hearing their concerns, we were able to come back, not in an offensive way, but in an informed way, and say, well, you said that you were concerned about that. This is how we've addressed it. And I think that meant that in the media, and the Australian medical media is quite rabid, it meant that we could play a fairly straight bat, to use a cricket analogy, in our responses. We say, well, this is what's in the training, this is the way that we're providing the service, this is what our standard is. But working together with them, organisationally, and also professionally working with the other organisations was really important.
Thank you, Lisa. Kerry, I might just ask you the same question because you touched on it in your presentation. And I know we've had discussions about this.
Actually, I would say the same that Lisa. Any objections, you have to be ready to have the answer. So you're afraid of this? Okay, we put that in place. You are concerned concerning this? Okay, we have this, how we manage it. So basically, be ready with a package addressing all concerns, depending on, of course, your countries and your situation. But also, at some point, you have to be a little bit pushy, especially towards the competent authorities and your public affairs body. At some point, said, okay, we do have a coverage issue in our country. We have less patients vaccinated. We have an issue. This is a real public health concerns. Do you want to be the government who do nothing when everywhere else, and now it's even more easy because there are more and more countries where pharmacists vaccine. So basically saying that everywhere in the world, pharmacists are vaccinating with no issue, no difficulties, no side effect, nothing. And you want to be the government that don't allow that when everywhere else it has been proven that this increased vaccination coverage. So at some point, personally, I would advise you to be a little bit pushy, saying, really putting the authorities in front of their responsibilities. They're in charge of public health. If in your country you have an issue with coverage and vaccination coverage, I mean, at some point, the authorities must take their responsibilities also. And if you manage to put on the table, again, all the concerns that you address, that you put on the table clearly, with no hiding anything, And on the other side, and then at some point, the authorities, they have less and less argument to not to let you do at least an experimentation. So again, my advice would be really start step by step, probably with something which is a lot of constraints at the beginning. That's for clear. You have to put in place the training, the data collect, the securitization process everywhere. You have to really border and secure everything. And then slowly, step by step, the thing with, once it's in place, be sure that there is no issue anymore after 2 years. This is something which is completely become common and natural. And now I can tell you in France, when I talk to GPs, they even don't remember that they were against 2 or 3 years before. For them, it's no more an issue. Pharmacist vaccine, and this fine. This is great. So this is really the first step, which is difficult. But again, be sure that once it's in place, there is no more discussion, there is no more argument, and everything goes smoothly. So really make sure that you address all, as Lisa mentioned, all concern, all issues, provide all reinsurance, push a little bit to your authority saying, hey guys, you're not going to be the countries where we stay with low vaccination coverage when everywhere else countries make progress putting pharmacists in the loop. And you will see that this should work normally.
Thank you, Corinne. Thank you. David, from a different perspective, and not as a pharmacist, but someone who advocates for the senior cohort of our population, you're dealing with doctors and pharmacists. When you're talking to doctors in your advocacy role, how do you promote the potential for pharmacists as vaccinators?
So I think, one of the things, the starting point for me is that, across much of the world, uptake in adult vaccination is pretty terrible. It's much, much weaker than it is amongst children. What's important is we increase uptake, not who does it. That actually we need someone who is qualified, whether they be a doctor or a pharmacist. I think that, to build on the point from Carrie, doctors are not the enemy here. Actually, there are some really perverse incentives for doctors to vaccinate, but actually when I talk to them, most of them say, you know what, we've got so much to do. You're already asking us to do X, Y, and Z as government. Actually, they recognise this, and to build on what Carrie was saying, actually it isn't an issue in the UK anymore. There is this recognition that pharmacists have an important part to play in this, and I do. It reminded me of I worked in Romania for a bit, and around the time of the introduction of professional midwives, and again, this is 20 or so years ago. At that time, there was this real sort of view that this sort of role should be done by doctors. Of course, now they would never dream of turning that around. Actually, the world does change in this important role, and I think doctors do accept that there's an increasing role for pharmacists to play. But I think two final suggestions, I suppose. One is that, I think one of the biggest barriers often is the sharing data. So if someone comes in for a vaccination in a community pharmacy, how does that information get back to the person's general practitioner? I think this is this should not be as complex a problem as many have made it out to be, but clearly there is a practical problem, and if there are things pharmacy can do to smooth this, I think that's extremely important. I appreciate systems are different across the world. And then I think, one way to get the doctors and indeed nurses and other healthcare professionals on board is if the goal is to increase uptake of vaccination, then let's get some community pharmacists, some doctors, some nurses to work together to develop some pilots, to develop some even randomized controlled trials on what is the best way these groups of healthcare professionals can work together to deliver uptake, because actually we don't have enough of that. And yet I think what that would give you and other countries across the world is evidence that this is how we can work together as different professions.
Thank you, David. To Lisa and to Karine, in the advocacy process, how important is it to have a champion for pharmacists within the political ranks? Because a lot of the solution is political.
Oh, look,
Lisa?
I'll lash into that. I would say very important. Having sort of done the rounds of the various states as part of the journey in Australia, I would say we were very lucky in Queensland that our Chief Health Officer, who's medically trained and has a background in infectious diseases and public health, which has happened to be quite useful during COVID and good for Queensland at that point. Very strong advocate of pharmacists and their role in the vaccination space. And that really transcended much of the political rhetoric around the turf war, because it was her absolute belief that increasing the population level of vaccination would have an absolute benefit for the overall health of the community. And so that wasn't necessarily my experience in all of the jurisdictions when I shared some of our data, because some of the public health units were led by nurses. I'm not being derogatory to my colleagues in other professions, but I'm trying to give a flavour of perhaps they had other agendas and other things that they were looking to protect. Maybe their workforce, maybe other particular things. Some of them were pharmacists, and some of the greatest barriers in other jurisdictions were pharmacists. So whoever was in that public health space, it was absolutely important that they saw that it was about the bigger agenda. And so I agree, absolutely important that you have somebody in government or somebody politically that is supportive. And the Cho and the Minister were absolute believers. And I think once one jurisdiction fell, I think Paul would agree that they all went like dominoes after that, once they saw the uptake and the benefit.
Thank you, Lisa. Karine?
Yeah, absolutely agree. It's important to have, I would say, a couple of champions. Obviously, on the side of the Ministry of Health, in our case, our Ministry of Health at that time was pretty much in favor. But also to have, I would say, a champion in the scientific community, especially within scientific society or academy, which would be perceived as neutral, and they're neither pharmacist nor general practitioner, or basically somebody really supportive on a scientific point of view and on a safely, but also mainly on interest for public health for everyone. So that's definitely important to have those two kinds of champions that can advocate for you, so that you're not perceived as really corporatist. I'm not sure it's something you can understand in English, but that's not something we do for pharmacists, but that's something we claim for the population and for the benefit of public health. So very important to have champions, definitely. And I would agree with Lisa. In this kind of circumstance where there are agenda we are not always aware, it's always a question of give and take. So probably, but again, I'm not aware of what kind of deal were made at that time, but probably GPs has agreed because they gain something else on another side. So there is always a part of negotiation that we are not always aware of, but definitely it's a give and take process. But what should be the priority is the benefit of all, and therefore the vaccination is definitely on the top of the list of the give and take.
Thank you, Corinne. What I might do now is just wrap things up with a few take-homes from the presentation. And it's important that from FIP's point of view, improving vaccination coverage is a healthcare imperative that requires responses from all health systems, including diversified vaccination gateways. It is not about taking some other professionals' eating their lunch, so to speak, but it's about improving vaccination rates by leveraging the most accessible primary health care professionals within most communities, the community pharmacist or the pharmacist. A couple of take-homes from today. If you are in a position where you are advocating for legislative change, have a package ready to present to the regulators or the legislators. That package would include training, data requirements, cold chain capability. Be ready to answer every query they have as to why you shouldn't do it. Because if you can tell them why you can do it, there's a much better chance of success. Involve all pharmacy stakeholders from the beginning of the journey. And as Corinne said, this is a journey, and you need to, and most journeys, all journeys start with a very small step. So it is a process, and you have to be committed for the long haul. Communication is important at all parts of the journey. And when you are getting to the point where you want to influence and promote, you need a strong press campaign. Start with a pilot, and a pilot is normally done with flu vaccination. For a number of reasons explained, it's the easiest one to achieve. It can reach most of the population and can have a dramatic impact in the course of a few months in terms of reach of population, because most people are happy to pay for a vaccination delivered by a pharmacist. And the direct knock-on for that is that pharmacists then realise their value in provision of a professional service. So it's not only a gateway to vaccination, but it's almost like an epiphany for a lot of pharmacists, because they then realise that people are happy to pay for a service provided in a professional environment in a pharmacy. Seek out a political champion and a scientific champion. That's important because they will support you through the journey. And at the end of the day, because we are such a highly regulated industry, it is a case of dealing with regulators and legislators, and you need their support. So I thank everyone for joining us today. We do have in September, Living and Learning Through the COVID-19 Pandemic, Global Reflections, which is a virtual Congress, which is being hosted by FIP. Registration is very affordable and highly subsidised by FIP for pharmacists from developing countries. I would urge you to look at the program at fip.org, and in particular, the plenary session on Monday, 14 September, and the hot topic sessions addressing lessons learned from the COVID-19 pandemic. A special thank you to our presenters today, to Lisa, to David and Carrie. Thank you for your input, your expertise and your insights. Most valuable, and I'm sure that all of the attendees have taken a lot from today, and hopefully the journey for them will be that much easier having been part of this webinar. Anyone who has some questions in the Q&A box that we didn't get to, we will certainly take every chance and opportunity to respond to you if there is an email address with the questions. If not, thank you for your participation from the audience, and we look forward to your continued involvement with FIP at future webinars like this. Many thanks to you all, and good night. See you, Lisa. See you, Kari. David, thank you.
Thanks, Paul.